Welcome back to Twin Cities Live. More than 80 million Americans have varicose veins like these. They can be extremely painful if they're left untreated. Plus, they make it really hard to feel confident in shorts or if you're wearing a skirt. And Emily Engberg met with a woman who's having her varicose veins removed with a laser at the vein clinic in Lakeville.
So, you're doing all right?
I'm doing good. I first noticed it about 17 years ago with my first pregnancy. It literally looked, the calf of my leg looked like I had been beaten. It was purple, completely purple. And I just thought it was a pregnancy thing.
After having her third baby, Sarah's symptoms didn't go away. Her legs felt tired and heavy almost all the time.
Then I noticed the protruding veins started. But to be honest, I thought it was kind of normal that everybody just had swelling in their ankles and legs at the end of the day because we're on our feet, we work hard. I thought it was normal that legs were fatigued. I thought it was normal that you'd bruise easily.
It's not normal, but it is common. Dr. Sam Gupta has treated thousands of patients with varicose veins, just like Sarah's. Now, they're very common in women, and while there's a genetic predisposition, your lifestyle can also bring them on.
Standing on legs for long periods of time, lifting weights, pregnancies, and then if you put on weight, if you decrease the level of activity, if you've had traumas, if you've had blood clots, it overwhelms these factors overwhelm the veins very quickly, and then these veins start to give up.
Here's what happens. When the veins give up, they can't push blood from the legs back up towards the heart. So it pools in your legs, and that's how you end up with bulging veins like Sarah's. Left untreated, the symptoms get worse over time.
Then you have itching, burning, cramping, restlessness in the legs. You start to notice some swelling, and then as the condition advances further, you have discoloration of the skin, you have infections and ulcers and blood clots.
There are a few ways to treat varicose veins. Dr. Gupta specializes in one called endovenous laser treatment. He uses a tiny laser beam to seal the vein shut from the inside out.
It's very precise and seals the vein down with minimal bruising and discomfort.
Sarah's leg is numb, so she's comfortable while Dr. Gupta works.
I feel fine. Yeah, there's no pain at all.
Some patients read a magazine or even take a nap during the quick half-hour procedure. And when Dr. Gupta is finished, the veins are gone and the leg is smooth again.
Was it here? Where was it?
I can't believe it. I don't know. I can't. You did good.
Oh, look at that smile, and Dr. Gupta is here with us now. Hi, Dr. Gupta. Thanks for being here.
Good seeing you, Elizabeth.
Okay, we want to take a look at the before and the after of Sarah, your patient. Okay, so look at the before and then the after. Is this pretty typical? Because that is incredible.
It's not uncommon, Elizabeth, although I must mention that this is only the tip of the iceberg. I don't know if you saw both the legs that Sarah presented with. Her left leg has the same amount of symptoms as the right leg, but she has hardly any visible veins on the left side. So our target is one of the big veins deep below the skin surface, and that's what makes people have the symptoms.
Wow. So I know you've studied at the Mayo Clinic, at Harvard, you know, two pretty good places to study medicine, I would say. And for the last few years, you've really been focusing on veins at the vein clinic. And what makes you want to work on this for people?
Well, I initially started specializing in wound care, and patients would present to me with swelling and ulcers and infections that wouldn't heal. And some of my patients had ulcers for 7, 8, 10 years that had not healed. And I kept looking for the source, which is poor circulation in the veins. But there was not a whole lot that was available. Either you had to put yourself through some painful vein stripping, or injection sclerotherapy. That is much easier, but it has a fairly high failure rate. And once we got one of the newer tools like the endovenous laser ablation, this has revamped our specialty.
How many procedures like the one that you did on Sarah have you been doing?
I would say I've probably done over 6,000 of these. We have thousands of patients who came to us with the pain and embarrassment of these veins that are now living you know, a happier life and healthier legs.
That's incredible. Well, and you saw Sarah's face there at the end of that story and just how delighted she was. That's got to be incredibly rewarding for you. And is that pretty typical of patients who you see?
Well, I think you summarize it so well. I mean, that is my biggest reward. I mean, it's so much fun to see this. It's not magic. It's of course technology. It's the science that has given us these tools, and given the right tools and understanding of venous disease, it is very doable, and the benefit is immense.
Yeah, I bet particularly a lot of women are probably thinking, why didn't I do this a long time ago?
And that is one of the reasons why we are focusing so much on education, because this is one of the 3 most common conditions. And yet, very frequently, it's misdiagnosed, and hence it's mismanaged. And by the time people come to us, they've been living with this condition for many years. And
you don't need to live with it. Thanks so much, Dr. Gupta. So nice to meet you. Thank you. And the Vein Clinic is a sponsor of Twin Cities Live. They have locations in Lakeville, in Chanhassen, and Hutchinson. And you can see there how to reach them. We're also going to post a link on our website. Just go to KSTP.com and click on Twin Cities Live. Thank you so much. All right, still to come, a special holiday performance from the Blenders and how to keep bed bugs out of your travel plans. We'll be back.